In your 10 years of your career so far, what is your most memorable moment?
There's so many memorable moments I would talk about, but basically saving someone's life, especially in cases of emergencies, and also maternity. When you bring in life, it's a beautiful moment.
So yes, how long should it take before a couple can start having intercourse again?
Now, the healing process is different for every person. And I wouldn't want to speculate or maybe say that after this duration, the woman must be ready to go ahead. Also depends with how complicated the procedure was for the woman. The emergency pill, that's a pill that you take in cases of emergency. And I repeat, in cases of emergency, because you're supposed to use them once or twice a year. Not twice or 3 times a cycle or every cycle that you're using emergency pills.
Just at the most twice a year.
Yes.
And of course, ladies and gentlemen, welcome to Kenya's fastest growing podcast. This is Lessons at 30 with Dr. Ofweneke. Now, we've been having a lot of conversations and I keep on telling you, my work on this show is to make sure that 100% 360 you are well off. Your well-being is well taken care of spiritually, psychologically, mentally, if I can use that word again, emotionally, and even physical health as well. It's important. They normally say that your health is your wealth. So usikona tembea hapo ovyo unafikiri kwa health na hujajiangalia. You don't know what is happening. There are things that are happening in your life, things that are happening in your body. Somebody in your family is not okay, and you do not know what to do with it. And so, ladies and gentlemen, I had to reach out, of course, to Kenya's number one brand when it comes to medical and especially matters reproductive, and that is Marisopes. And I had to reach out to them, and of course we had to have a conversation. I mean, we had Salan on the other episode. We talked about vasectomy, and I'm really happy about the conversation that generated from there. Oh, mi siwezi finywa. Oh, mimi siwezi sijui what, mi bado nataka kuzaa. Najua Waluya walikasirika, sisi hatufinyangi vitungo, sisi lazima tuzae. So today we want to just get deep into the conversation. And you as a lady, you're watching the show and you're wondering, which is the best method for me to use? Because I just keep on giving birth. How can I stop it? Yes. And by the way, I have never seen a female condom. Apparently it exists. So we're going to be talking about life on Dr. Ofweneke, Lessons at 30 with Dr. Ofweneke. But please make sure you subscribe on Dr. Ofweneke TV. And how can I forget to say this? Happy birthday to Marisop. 40 years of being part of Kenya's health. And of course, let's see what they're doing. Ladies and gentlemen, allow me to invite, she is the branch manager of Pangani Marisop, Pangani branch Mariestope's. Ladies and gentlemen, the soft spoken. She is such a nurse. She has such a calm soul. Oh my God. I think in another world I should have married a nurse. Watu kunywa na oa influencers. Where? Ladies and gentlemen, Feather Ntinyari. Welcome on the show.
Thank you for having me.
Karibu sana. How are you feeling?
I'm good.
Pole tunakuanga na chai. I promise you. Nivile tu yani ni holiday. Lakini sisi ukuwa na chai. But there's a lady called Pinky. Blame it on her. Kama hakuna chai, usitafute the Pinky is the person to blame.
I'll look for her after the show. She should give me my coffee. Thank you though.
Welcome. How are you feeling?
I feel good to be here.
You okay?
I'm honored to be here with you and to discuss the things that we do on a daily basis.
Beautiful. You are a nurse.
Yes, I am a nurse by profession.
Hakuna kitu ingine ungedu? Why nursing?
It's something that I wanted to do since childhood. So when I cleared Form 4, and it's the only thing I could think of doing.
Being a nurse?
Yes. Initially, I thought actually I would do law, but the subject cluster that I had chosen did not go, but I was a science person, so I really wanted to do a medical course, and I ended up doing nursing, which I enjoy, and
you do?
yeah,
How
I
many
don't
years?
regret. Over 10 years now.
You're not scared of blood?
I'm not scared of blood. I've also worked in maternities, and you kind of have to work with blood through and through. So I'm not scared of blood.
What in your 10 years of your career so far, what has been what is your most memorable moment?
There's so many memorable moments I would talk about, but basically saving someone's life, especially in cases of emergencies, and also maternity. When you bring in life, it's a beautiful moment. So I would say that's it. But basically saving someone's life, offering women choices, it's what I do and what I love.
Wow.
Yes.
I once my third born is around 6 years now.
Congratulations.
Thank you so much. Nikajifanya kimbelembele the day she was being born, nikaingia maternity kwa ward akizaa delivery room. I have sworn never again. I almost fainted. Oh my goodness. Why what is this stereotypical idea that nurses are rude?
It's basically a stereotype and also an old mentality. I would say that because with the current generation, there's nowhere you'll go for services and someone is rude to you. It's just that people were really used, or even with, especially with the government. I'm sorry to use that.
No, it's okay.
But with the government institutions, not even only in hospitals, you'll find that the reception or the customer service that people experience is not really that courteous. And also there are things that someone is in pain, like for maternity, let's say,
yes,
and you're telling them to relax or to cooperate to what you're telling them to do. It would feel like you don't feel their pain. You don't understand that they're in pain. And basically that's what makes people think that nurses are rude. But ideally, they're just trying to help you to bring this life. Because mostly in maternities, that's where people complain that nurses are rude. But having someone to cooperate when they're in a lot of pain, it's not an easy thing to do.
Yeah, but
to expect from them.
There's a lady who told me that she was delivering, and and I hope it was a joke, but it really sounded serious because it was very personal to her.
Yeah.
That alikuwa usia na deliver, then akipiga nduru nasa akamwambia wakati uko napiga nduru ile time mbona.
Wow, that's purely unprofessional.
And I was like, oh my God, ouch, she's supposed to be supportive. And men, we've gone through a lot. Before we really get into the topic, are cravings real? I am asking on behalf of men. Are cravings real? Because men, we feel like cravings are there to punish us.
Not really. They're not there to punish you. Sometimes women, when they're pregnant, because of the hormonal changes, they end up having the cravings. Sometimes they're a bit exaggerated, or we...
Thank you.
But sincerely,
no. Just wait. I this is a moment of celebration. I always knew the mother to my first two daughters. When Debbie was being born, Debbie is now 10, 11 years. Imagine aliniamsha saa 9 usiku. And this is a true story further. Saa 9 we were living in Ndegwa. Saa 9 usiku akaniambia anasikia tamaa ya omena. At 3 nikatoka Ndegwa baka Nakumati UK, that was in Westlands. Ake nikabaya omena. 1 hour later saa 10. Further, do you know how it is kupika omena? Saa 10 asubuhi. Omena ina siri. Kwanza sauti na harufu. Ake nilileta hivi, and I promise you and I swear, and she's watching, Nika alikula omena moja.
Unfortunately, with pregnancy and the hormones, you could be feeling even cravings or feel angry in the middle of the night. You want to eat something. Sometimes, yes, and as I said, the cravings are real and they're there. Maybe the particularity of whatever someone is asking for may be slightly exaggerated, but cravings are there. The people who crave. You've seen pregnant women even eating some things that you wouldn't even call them healthy.
Mawe.
Yes.
Is mawe, what is the benefit of mawe during course? Mademu wengi upenda kuzunguka kwa mijengo.
Not really. It doesn't have any health benefits. Actually,
it doesn't?
No. And that's why we tell them to come to the clinic early so that they can get counseling and also iron supplements so that they're okay. And some of the cravings can be altered by that.
you've just broken a myth. So Mawe has no effect.
It doesn't have health benefits.
Kuna dem nilipata kilamba ukuta. Hadi mtu yeye anasikia tu anataka flats, apartments.
Can you imagine the contamination they're getting from there? They can even easily get infections. And that's why we tell them to start clinically. They'll go through counseling and also be advised on what they can use.
Okay.
Yes.
Mariesopes, you guys are celebrating 40 years.
Yes, 40 years.
Congratulations.
Thank you.
How many years have you been there?
I've been in Marisop. This is in June, it will be my 10th year in Mariesopes. I've been in Marisop for some time.
Do you enjoy being there?
I love being in Marisopes.
What is the best thing? What is it about Mariesopes?
Marisop, one, it's an institution that is quite comprehensive in what it does, and it also offers quality services. In quality, I would say as a nurse, when I enrolled, I wanted to be able to help people and to help women.
Okay.
And when you're in a position where you're doing the right thing at the right time, and there are no gaps in whatever you are doing. Like, for example, where I operate, you're working with qualifying personnel that have gone through the necessary trainings. There are quality assessments that are done, and you're not mismanaging people. So at the end of the day, you're getting job satisfaction. I don't know whether in your work line you get to have the satisfaction of doing what you've like. You woke up in the morning, you went to work, and you did what you really wanted to do, and you didn't put anyone's life in danger. That really counts for me, and that's why I like being in Mariesopes.
What is the history? When did Mariesopes start?
Marisop started in Kenya in 1985. It's an government organization, an international organization. So we have branches all around Kenya, but also there's Marisop International.
How many branches?
For our branches, we have total 16 clinics. 8 are within Nairobi, in different areas within Nairobi. And also we have 8 which are outside Nairobi. We also have one nursing home, our Eastleigh Maternity and Nursing Home, that offers comprehensive maternity care and also other reproductive and healthcare services.
Beautiful. My God. Services? So
we offer comprehensive services. I know previously people have known Marisop for being a reproductive healthcare facility only. So when anyone hears about Marisop, they would just assume that Marisop is just offering reproductive health. But contrary to that, we offer comprehensive general health services. We partner with different insurances for healthcare. So even if you're feeling unwell, we have a branch nearby in Kilimani, or you come to my branch in Pangani.
I thought Marisop is for ladies.
No, it's not for ladies only.
Are you serious?
Yes, we also attend to men.
Okay.
Yes.
The notion has always been that Marisop is a ladies.
Like, you see, there's the core of a mission, or the mission that you work with. Basically, we are a reproductive healthcare center, but because of healthcare, we have integrated other healthcare services. So reproductive health is our core service, is what we do. But we also do other things. We do STI screening and treatment. We also do cervical cancer screening for both men and women. Yes, for men, we can do the prostate assessment and also screening. We're also doing that. And it's a whole comprehensive maternity services are also available.
So
laboratory,
it's a fully fledged, gender balanced facility.
Yes, imaging services, they are all available, and it's comprehensive.
You've touched about prostate screening.
Yes.
And a lot of men die because of prostate cancer. Not because of anything, because we are normally scared of the process of me mtu ataniingiza kidole pata.
So even if you're not going to do the usual, the physical examination, if you're not fully comfortable with that, there are also tests that are done.
No
the
man
PSA.
is comfortable. Not that matter. No
and
man
remember,
is
there's no man who is comfortable in that. But can you imagine losing your life because of something that you could have detected early and managed? You have a lot to do. You mentioned you have children. Those children depends on you fully for their life, for their future. The fear that you have compared to what you do all change if you have an issue and it's diagnosed early.
True.
It would go a long way. And remember, you are going somewhere where you'll not be judged. You'll be respected and supported through the way.
Sasa mimi kama kwa mtu wa TV daktari anaangalia sema huyu jana
acha tu nitumie hii slogan, we see, we don't judge.
You're even making it worse further.
No. Like, we don't remember. We assess people on daily basis. Different people.
Remember?
We don't. When I'm looking at you and I'm assessing you as a client, I don't really think about you. I'm not looking at your features and all that. Remember, I'm looking for abnormalities, for any issues.
Safe enough.
And you can imagine how many people I assess on daily basis. All I've assessed in my life right now.
Have you assessed somebody like for prostrate?
Yeah, we assess men.
Wewe umefanya?
Yes.
Wacha ikae. But now there's a modernized method.
Yeah, there are modernized methods. And also we can just take the blood sample to test for the PSA, and then we'll be able to be informed on now the next steps. And also referral processes. We go through that.
Thank you, Jesus.
Yes.
Thank you, Jesus. At least.
So let them come. We don't have to jump direct into the physical examination. We can start by doing the assessments first.
Okay. Now, I was just doing a research about MARIESTOPES, and something caught my attention.
Yeah.
What do you mean by being a true woman wellness service provider?
Thank you for asking.
Because it sounds like a magazine, like True Woman Welcome. Let's talk about.
Now, when we say we are true women wellness provider, it's because we are comprehensive and intentional in caring for women from menarche when they start their menses to throughout their reproductive age, when they're getting children, planning for their families, to when they're starting menopause. Through all those screenings that women go through, because women go through different stages of life. There are so many questions, so many issues that come in with being a woman and going through your normal reproductive process that really requires attention. And when you require this attention, you need to get the attention then from someone who is informed, who is trained, who has information.
Menopause, before we just go ahead.
Yes.
Do men hit menopause?
No, they don't.
Thank God. And women, I feel like the age has started inakuja karibu of late.
Not necessarily. Still, menopause, we say it's from the age of 45 to around 55. Though some people can start early. So it depends with each and every person. There's some that are not like the normal physiological processes that could call to be more of a pathological process. For example, you are 30 or 35 and you've already started having signs of premenopause. So that wouldn't be judged as being a normal aging process. And probably you need now to go through hormonal analysis to be able to see whether everything is okay, or there's another underlying cause that is making you go through the early menopause. But not necessarily. I know that life has changed. Even the diet, the things that people are using could in a way contribute to all that, but it needs to be assessed if you start experiencing the premenopausal symptoms.
Is there like a specific diet that affects
menopause? Not necessarily. I wouldn't put it at that. Because something that affects your hormones definitely is what could cause you to go.
So ikifika imefika.
Ikifika imefika, but there are support systems. There are things that can be done to support you through the process. Yes.
What happens, and I don't know if you have an answer for this, I'm just asking from a layman's
sure.
understanding. What happens in cases whereby you thought you're actually at the menopause era, then bam, you actually find yourself pregnant?
So I would say in such a scenario, you would, of course, need to go through comprehensive counseling. And even for you to now go through the process and think through what you really want with yourself and with your life.
Okay.
Yes.
All right. There's a term you guys use, every stage of a woman, every stage of woman. What does that mean?
So every stage of a woman is basically where we are supporting women through their stages that women go through. These are women who's just started a menses between 16 to 22 years. That's a young woman who has started a menses, who is going through the the adolescent and also the stages of starting a life. They are maybe in the campus or the university. Or the other woman who is between 22 to around 39 years. This is a woman who is going through the mother, the woman who is a mother who is getting children actively. Probably they would want to space their children through that process. There are also challenges that come with being pregnant, the antenatal clinics, the postnatal care, the delivery, all that. And then there's between 40 to around to and above. The woman who is going through now stages where they don't want children anymore. They find probably enough number of children. They're also choosing maybe permanent contraceptive methods. And some are starting now to go through the premenopausal stages, and others are in menopausal stages. In all these stages of women, they also need to go through the reproductive health system assessments, like the cervical cancer screenings, the breast examinations, and also screening for breast cancer, also for STI screening and testing that are necessary during all this duration, because I would assume they're sexually active at this point also. Yes.
Well, there's a myth, and I as a medical practitioner probably can make it clear to us. Is it true that, especially in cases of, let's say, probably STI, that the people might be they might be a carrier? And is it a carrier? Okay, let me use another statement to make it easier. Then kuna mtu anaweza kuwa ako nayo na sijui hawezi infectiwa ama what was that thing I had?
So
then kuna mtu ako nayo but hawezi infect mtu.
As long as you have an STI, you can infect someone. Unless it has been treated and probably it's still testing positive, which is a rare occurrence. Unless for just syphilis, sometimes it can take some time before it turns negative after you have tested positive and you've been treated. But let's be clear that as long as it has not been treated, you will still infect your sexual partners. What they say is you could have an STI and not have symptoms. Like, yes, like the HPV virus, you could have it and still you have no symptoms. Chlamydia, you could still have it but not have any symptoms. And that's where STI screening comes in. And ideally, as long as you're sexually active, you'd probably need to do an STI screening once a year or when it's necessary. For example, if you have any symptoms that you feel, discharges, or all these other things, that low abdominal pains that you may be having, that may signify that something is not right in your reproductive health system, or even lesions or blisters. Those are things that you need to be assessed. So screening can be done once a year when you have symptoms, and also when you have a new sexual partner. It's important to be screened.
Then everybody in Nairobi should be screened every day.
Oh, Nairobi.
Are the symptoms in a man the same as the same in a woman?
Not necessarily that they will be the same. There's some that would be, and the others that will not.
What are those symptoms?
There would be either urethral vaginal discharges that have maybe a smell, different color, or it could be clear, but it's not the usual discharge that you experience. There could be some blisters or rashes that develop in your private areas. Also, you could be having pain when you pass urine, or even low abdominal pains that may come with back pains. Those are some of the symptoms that you may experience if you have an STI or an infection. Yes.
I hope, guys, you're watching once a year, but Nairobi, it is advised, visit the nearest MARIESTOPES every single day for a screening.
Yes. And if you need more information on this, kindly, you can reach us through our toll-free number, 0800 720 005.
It's right there on the screen.
Yes, you'll be able to be informed more in regards to all these things and where you can find us.
So let me ask, who do you target most of the time?
We don't target a specific because, as I said, we are now open, not all integrated in our services. We can be able to see men and women, but our target is basically the women within the reproductive age.
I hear you.
Yes, between 16 to around 49 and above, because we are targeting these people with their reproductive health services so that we can be able to give them information. Because I believe information is power.
Yes.
Sometimes when you have the information, you are able to make choices. You could be having a problem, but you haven't even realized it's a problem. So it's good also to do the usual health screens. Yes. And so when we talk about our target population, it's usually women through all stages of their life, so that we can support them with what they're going through. We can be able to inform them, is this within the normal, or is this out of the normal occurrences? And as we target these women, we also want them to come in with their partners, because their partners are the ones who are supporting them through all this process. Yes. And that's why I've said, I wouldn't say that we are targeting women only. We also want to target even the men, the partners, so that they can come with their women, we can support them, and they can be able to have a normal flow of life, and at least their health burden can ease in a way.
Because at times there are times we get really confused. And I tend to think women have a lot of personalities in one, and at times we're never really sure. We're like, I'm gonna be come home now. Then I've come home on Yongeleshi, and I'm like, okay, why did I come home now? And you don't want to talk to me. So, and at times men, we really get confused, and a lot of time we never really know what to do with you guys, especially when either emotional or physical health. We never really know what to do. And I think it's really good that MARIESTOPES, you've really done a good job in terms of incorporating the whole putting the whole circle together. So we also feel part of the conversation, because at times there are times we never really know what to do with you guys.
Yeah, I know sometimes women can be a little bit complicated, but you can imagine
little.
Yes, I would call it that.
Oh my God.
Men need to understand us, at least in a way. You understand the cycles women go through. For example, if you know your woman's cycle, in a month, a woman will go through 4 phases.
4?
Yes.
Those are literally 4 personalities. I told you.
It's not 4 personalities, because they also come in with their own things. And if you understood, like, right now, you understood that your woman is going through the menstrual phase.
I don't have, please don't specify.
No, it's okay. Sorry,
I only have daughters.
No, even your daughters, because they'll also get to the adolescent stage.
Yeah,
the
like
pre
Faith,
and that.
Faith, my firstborn, is already there.
Yes.
I think she started experiencing it, I think last year.
And you'd be able to support her more if you understand that she's also going through these cycles. And probably with that, even in the future, the woman that you're going to have, you'll be able to understand her more. And when you see she's moody and all complaining and everything, you'll be able to understand what she's going through. And you can just be like, oh, okay, so this is it. And when she starts jumping around and telling you come home early, you just schedule yourself. You can even, like, now people are quite advanced. You can follow a cycle through your phone.
Stage 1?
Yeah, so there's usually the first stage where she's having her menses. That's the first stage of her cycle, where the hormones are completely, that's when the cycle is beginning. And now there's also the ovulation stage, Sawa, where she's now ovulating, there are hormones, she's excited and all happy and
she
everything.
Wants you.
Yes.
Hey baby, come home, takula.
Yes, and then there's the post-ovulation stage where the hormones now have calmed down and she's all okay. And you can see she's a bit, you'd see maybe her diet, she's starting to have a lot of cravings and she's eating almost everything in the house.
Yeah.
And then the stage comes when she's all moody and she wants to kill you and throw everything on you. And it's upon you now to understand that it's also a phase that she's going through, and it's going to be through. If you support her, if you're there for her, then it will make it easier even for her to go
How
through
can I
that.
be there for you at stage 4? Stage 4, how can I be there?
Just be there, because if you're not there, it will even make it worse.
So I just sit there, you insult me.
A lot of imaginations. I can tell you, sometimes when someone insults you, not basically for women only, and you realize, oh, this person is going through something, and you don't engage in that conversation. You don't engage in that fight. You are all calm. She'll also not continue to do that. Yes, she'll not.
When were you in Nairobi, Ama?
Mimi wa Nairobi, but nimekuja Nairobi.
Basi no. Wait. Ukinyamaza ndo sana. Kwenda! Doggy, whatever. Like, hey, your doggy tena. Why would you? I mean, you married me. I am your choice. Why did you choose a dog? Hey, well,
labda tu anamaanisha wewe ni ndogi yake. Si
well.
people are keeping pets. And on a later note.
Further utajihost. I swear utajihost. No. Did you just, for the first time in the history of humanity, did you just try to flip that? And to mean that,
No, we are supposed to support them. And that's what we are saying through it all. No, I'm sure they don't do that.
Stage 4. A lot of men get... Stage 4 is crazy for us. We never know what to do. Unaleta sijui mafuta ya a certain brand, unarudishwa nayo, unaambia sini kwa nataka, unaleta sukari nusu, unaambia ilikuwa nataka quarter. You're like, what the hell?
Now, in that case, then, if you know she'll do that, you just tell her, hey, can I take you? Can we go shopping? That way, she'll just pick what she wants. Or your credit card will start complaining.
I give this girl. Men, we are watching, but we are not judging.
Yeah, you should.
A lot of kuna na mpaka na sahi wanajua ni kunoma sahi nyumbani. You know time stage 4 ndo mtu andikionga we need to talk. Miss kuji home. Fedha mimi we need to talk. I'm not coming home. Now let me ask what so you've said mostly the primary services are based on women reproduction.
Yes, reproductive health.
But I also want to connect it to and it's becoming a common conversation today.
Yes.
And having Solano on the show in the past episode ago, the issue about vasectomy.
Yes.
Further, what the hell is vasectomy?
So,
please make it clear to us. Because where I come from, the Luya community, we don't fancy, and I'm pretty sure you've heard of this. The Luya community, we don't fancy vasectomy. For us, we're very procreating society.
I know in our communities, and being an African, I also come from Meru, where men are really...
Yeah, I know. Meru men and Luya men and Kales don't joke.
It's on its own level. But vasectomy, it's a permanent contraceptive method for men.
Permanent?
Yes.
So it cannot be reversed?
Vasectomy is not reversible. It's permanent.
So once you finya, it's unfinyable. Yeah.
And don't use the word finya, because it's not necessarily about finya or anything.
You're about to say finying.
Yeah, finying or something. Trying to blend in any. But vasectomy is basically just tying the tubes that transport the sperms.
Okay.
So it does not affect the man performance in any way. You'll still be a man. But if I could ask, how many children are too many?
Well, you don't ask a Luya man that, because our society does not allow us to count children.
Yes, you shouldn't count children. I would respect that. But at the same time, you also need to have the number of children that you can be able to take care of and provide them with the kind of life that you want.
You wish as a father.
However much as African and in our communities, we may not really want to count the number of children we have. I'm sure at the back of the mind, you know the number of children you want in your life.
True.
At some point, you may not really go for the number that you really wanted, but at some point you really knew, like, yes, I would want children in my life, and I would want 3 or 4 children. I would want 6 children. I would want none. I would want 2. It's a choice.
Okay. For me, I think the 3 I have are enough. I can't imagine right now doing diapers.
Now, when you have gone through the process of reproduction, and enough children that you really planned for, that's when you now make a choice. Do I ever want more children? If you don't, that's when you go through the vasectomy procedure. It's a short procedure.
How long does it take?
Around 20 minutes to 30, and it's effective.
So it can backfire?
We usually do proper assessment after the procedure is done. There are tests that are done because even after vasectomy, the first 3 months you can still make a woman pregnant because the process of sperm formation takes around 90 days. So within that duration, you could still be able to produce sperms and
Impregnate.
yes, and impregnate a woman. But after that duration, then there are tests. We do a semen analysis to be able to see whether there are sperms in the semen that you are producing, so that we are able to for sure tell you whether whether you are in a position to still make a woman pregnant or not. But your performance as a person continues to be as usual.
Because I know the biggest fear for men is
the performance.
What?
I know, and that's why
Yeah.
I'm mentioning it quite often. But you can imagine all that women go through through the phases, through pregnancies, through deliveries, some through normal deliveries, complicated or uncomplicated, others through cesarean section, and healing, breastfeeding, and raising now those children. When we start to get contraceptive, there are also some beta side effects that come with these methods. As men, it would only be fair if you supported your woman. If you guys have gone through all this process, you've seen her go through all that. Now that you've had enough children, if you hand a vasectomy, then it would mean that this woman will at least take off the load of having the side effects that come with contraceptive, because some contain hormones, and these hormones come also with their own side effect. So you would be getting a whole load off her shoulder.
Hey. Because a lot of men are watching this and they're like, you know what, I'd rather just, come and buy, withdraw.
What is the effectiveness of withdrawal?
Sinikuruka tu nyumba.
As much as we are talking about withdrawal, nakuruka nyuma and all that, the timeliness of the time that one withdraws, also the pre-ejaculatory fluid sometimes contains sperms. So there's risk that are involved with using the withdrawal method also. So you could be thinking that, I'm using withdrawal, I'm using safe days, I'm okay. And then you end up pregnant. And you guys and discuss, maybe the health condition of that woman does not allow her even to be pregnant again.
Oof. You've touched on something that I probably know is of interest to students, lessons at 30. CS.
Yes.
And there's a lot of conversation. I've had a lot of couples have issues around that, especially for us men. Because see, for ladies, your libido at times is unpredictable. There are times you really want to have sex. Then there are times just like, siniguze unanuka nywele. Siniguze. I don't know why you guys choose very weird things. Unanuka nywele. Why the hell would you deny me sex and unanuka nywele? I don't get it. Nywele kona roof. Then there are times you're like, hey, come home now. Watoto laleni. You get. But for us men, we normally say men don't need a reason. Men just need a venue.
Yes.
So yes, how long should it take before a couple can start having intercourse again?
Now, the healing process is different for every person. And I wouldn't want to speculate or maybe say that at this duration, the woman must be ready to go ahead. Also depends with how complicated the procedure was for the woman. But most of the people within 4 to 6 weeks, they should be okay to proceed. However, it depends with how soon this woman is okay. There's some who recover quite fast. After the cesarean section, they leave the hospital in 3-4 days, and they are not, you can start immediately. They need also at least that bleeding to be done. Yes, and at least the incision side to heal a bit so that they're not in pain, because I assume they also need to enjoy all this process. It's not always about obligations, but it would be upon the couple to discuss, and also to have a healthy relationship where they can discuss these things. As long as the woman is okay, she can be able to proceed, but at least the first assessment have been done. After 2 weeks, they need to go for assessment. because by the time they're starting now the normal immunization within the first 2 weeks are those immunizations that children also need to get.
Yes.
And considering your cesarean section birth, you need to go back to the hospital for review, for assessment of the incision site, just to make sure that everything is okay. So once you've been assessed and everything is okay, then you can be able to make other choices.
Okay.
But remember, this woman is also now introduced to a whole new phase. She's breastfeeding, taking care of this newborn. A lot of emotional turmoil goes through that phase. That probably being intimate may not be the first thing ringing in her mind, but it's purely totally different for a man. And that's why I've talked about having a healthy relationship where you discuss now these things openly so that both of you are able to understand each other and know, oh, this one has my partner has these needs. I know I'm going through this, but I also have to put all this into consideration. But as a man also, you also have to support your woman and see what she's going through and see how you can support her until at least she has healed and you are in a position no one will feel like they were harassed into anything.
Right. Yes. Let's go deeper into contraceptives.
Oh yes.
So for men, the only two options, correct if I'm wrong, is it only with either withdrawal process or vasectomy?
There's withdrawal, condoms, and vasectomy.
Condoms.
Yes.
I've had women complain. There are women who complain, especially on the condoms. There's a women who they are, I don't know, it's latex intolerant or something. There's a statement.
Yeah, some could be having allergy to latex or rubber. Yes, it's a possibility.
It's a possibility.
Yes.
So men, you can either use a condom, withdraw, vasectomy.
Yes.
And now apparently there's a woman condom.
Yeah, there's a female condom.
There's a female condom.
Yes. It has been there. Only that people are not informed about it so much.
Oh, it feels weird.
It doesn't. It's a condom.
How does it look like?
Would you like to see?
For the first and the last time in my life.
Doesn't have to be the last. So you can have you can have a feel.
Why?
It's still sealed, so just have a seal. I feel.
That is a female condom. How is okay? For educational purposes.
Yes.
And please, if you have a child around, please pause, send them somewhere for some activity as you can do. This is really, really, really important for women in reproduction. How does it work? Because I don't think it's very true. A lot of people don't, because most of the time, the role, I'm not going to call it a burden, the role of wearing a condom is normally left to the man. But a lot of women don't actually know that they can actually put on a condom.
Either male or female, the role of having a condom or using a condom should be for both parties. I believe even for male condoms, women should be able to know how to use it so that they are also not misled into anything. Now, for the female condom, I'm going to open this. It usually has 2 rings. There's usually the outer ring and the inner ring. It's not as bad as you think. So I don't know whether you can be able to see it. This is the bigger ring is the outer ring and the smaller one is the inner ring. Okay?
Okay.
So when you're using it as a woman, you squeeze it, and then you insert it vaginally. This one should be left around the vulva, the outside. Mostly we advise at least you put it 1 hour before use. So
1 hour?
Yes. But it can stay there for, it's not uncomfortable to say the least, because I know women even use tampons. There's even menstrual cups. So once you've put it there, the intention is for it to, the rubber and hole to align to the vagina has folds. I don't use complicated terms. It has folds. So when you put it and you give it time, it will align to the lining of the vagina.
Okay.
And in that way, even when you're having sex, then it will not be noisy and all that. It will already have aligned and it will be comfortable for both of you.
Oh,
Yes.
So advisably 1 hour before intercourse.
Yes, but you can put it even longer. It's not an issue. And I'm saying this considering probably you know your life and you know the choices that you make. So you can make a decision on what you feel is more convenient for you.
Okay.
Yes.
All right. The other option.
So the other ones for the condoms, we also have the male condoms.
All right.
I'm sure almost everyone has seen a male condom.
Yeah.
I don't really need to open this. Do I?
Well, there's also I've never seen it
So it's well lubricated.
already.
Yeah, the condoms come pre-lubricated.
One can get the either.
Yeah, you can get either from
MARIESTOPES.
Yes, you can
All
get
right.
from our branches. So this is a male condom. So let me just say what you need to do when you're using a condom so that at least you have the information. First, you have to check for expiry and make sure that the condom that you're using is not expired. Condoms also have expiry dates.
So this one expires 2028.
Thank you.
Sam. Oh.
I have some more. Don't worry.
No, I'm celibate.
Amen. Amen to that.
Behave
I'm
yourself.
saying
You're
amen.
a client.
Yes. So once you check the expiry, you also have to just press it. You see, there's hair in it, just to make sure that there's no perforations or anything on the condoms, or it's not torn or anything.
Okay.
Then apart from that, you have to look for where to open the condom.
Okay.
Msitumie meno ama makasi or anything. Yes.
Meno ndio rahisi.
Hapana, meno si rahisi kwa sababu in the process you can easily tear off the condom and you continue using it thinking you are safe. Remember, condoms will protect you from pregnancy and also from STIs.
Yes.
Apart from the infections that have lesions, ama blisters, vidoda. Those ones, because of the discharges around the area, they may not be able to protect you. Okay. But these other STIs, HIV, pregnancy, it will be able to protect you from it.
So first check the expiry date. 2, you just check around it if there's air in it.
Yes.
Right. Then
you cut from one side.
Okay.
So once you've done that, you have your condom.
It looks familiar.
Yes, thank you. I knew that. Now, once you have...
Anyway, but moving on.
Once you have your condom ready, you should be able to, on an erect penile, I'll just go straight to the point. I hope you forgive my language.
Why are you being shy?
No, I'm not being shy, but I know people don't like to use to call it as it is. Now, when you have the condom, you have to pinch the top of it. Okay. This is to avoid any air being in the condom. Okay. As you put it, and also it will be the area where it will collect the semen that will be produced. Okay. You roll it down, all the way down. Now, after the intercourse, yes, you should be able to remove the condom while the penile is still erect a bit to avoid it being left inside and also to avoid spillages. And as you remove it, you hold the rim to avoid spilling the content to the lady. Also, dispose it correctly. Hatutaki kuona watoto kwa mtaa wakipuliza balloon, si zile balloon za kawaida. So, probably just to avoid flushing them in the toilet.
Not to touch.
No, I'm just being real.
I got you.
So you can just you just fold it in a tissue, just the way I've done here, and dispose it in the dustbin or somewhere appropriate. Kindly do not haribu our environment.
Thank you. Yes. As you do so, let me ask a very useless question.
Sure.
We've had cases of guys saying, odem alingoja nimelala, because of course, men after climax, we tend to feel a little bit sleepy. There've been cases whereby guys say after an dose, odem alichukua CD ikiwa na my sperms na akajiwekea or something. Is it a myth or is it true? After intercourse, how long does the sperm cell survive in exposure?
So external exposure, I may not say exactly how long it will take, but once they have gone into inside a woman, they can stay for up to 3 days. They can fertilize for the next 3 days. And just to be clear, if you were if you had an intercourse or you're sexually active, the woman is still wet a bit. And if the sperm, that's why I've said you avoid pouring them on her or spillages. Because even if the sperms are poured on her, on a vulva and all, they can still swim.
Oof.
Yes. So if she doesn't take long enough and does that, it's possible that she could, yes, if she's ovulating, get pregnant.
Scary, but it's fine.
Yeah, okay. And then that's someone who is quite intentional on what she wants.
She wants to do.
Yes.
There are men outside there, of course, who are raising kids that they really didn't want, truth be told. And others, you was kinga lilitrapiwa, dem alichukua nini akakimbia nayo, CD akakimbia nayo kama bado imebeba. Wanaume tunakipitia. Nyinyi viumbe wenye mliumba wakati tumelala. God I get to involve your process. We had to sleep. We thank God for you guys. Now, so we've checked on the condom method, which balances on both,
yes,
male and female. Then muskia coil. I have never seen how a coil looks like.
So basically, there are different options for contraceptive. I would just like to start from there, so that also our viewers may be able to understand more. There are short-term methods and there are also long-term methods.
Okay.
And then we go to the permanent methods.
Yes.
So could I just explain them based on the durations that they last? So briefly, when we talk about the short-term methods, these are methods that you use for a short duration. For example, the emergency pill. That's a pill that you take in cases of emergency. And I repeat, in cases of emergency. Because you're supposed to use them once or twice a year. Not twice or 3 times a cycle or every cycle that you're using emergency pills.
Just at the most twice a year?
Yes.
At most?
Yes. Overuse of them may lead you to have hormonal imbalance, to put you at risk of complications. So it's really, really important that people understand that if you're using an emergency pill more than twice or thrice a year, it's an indication that you're sexually active and you need to get a contraceptive to be able to help you with that. Now we go to the short-term methods. For the short-term methods, we have daily pills. These are pills that you use on daily basis. For the daily pills, there are 2 options. There are some that contain progesterone only. These ones, we use them for women who have just given birth between 4 weeks to 6 months of delivery. They are still breastfeeding. They don't affect milk production in any way, which is an important factor for women and children also. So when a woman has just delivered, maybe she wants a short-term method or she has not decided on a long-term method she wants to use, then she can take the daily pills for the first 6 months. But after the 6 months, if she still wants to continue with pills, we change them now to the other pills that contain both estrogen and progesterone. These ones have a tendency to reduce the milk production a bit. But after 6 months, the baby has already started feeding and maybe the mother is also working. So the milk production is not really a factor because it's not like it stops the milk production. It just reduces a bit. So these are the pills.
So this is
now combined pills. They're daily pills. You take them on daily basis.
No side effects at all?
The side effect that comes with them depends on each and every person. When you're starting, you may feel a bit nauseous.
Okay.
Yes.
But this one, it's okay medically advised.
Once you get an assessment, I always insist when you're getting a contraceptive, it's good to be assessed because you could be hypertensive or you could be having another condition that contraindicates using this.
Okay.
So it's always good when you're getting them, you get them from a health facility where your pressure will be taken, your history will be taken, and you'll also be advised on what to expect. Remember, you're taking them on daily basis, the same time every day. So if you forget to take the pill, you need to know what to do next.
So what do you do next? If you forgot
Depends with how many pills that you've forgotten. There are times that we tell you if you are supposed to take, for example, I was supposed to take my pill at 8 a.m. I remember now, oh God, I forgot. It's already at 12. Then I need to take that pill at 12. And tomorrow I continue with my 8 a.m. schedule.
Oh, okay. So who decides? It's a doctor or you can make
decide on the time that is appropriate for you. Because I may decide for you 8 a.m., you wake up at 9. Or at 8 a.m., you're doing something else. So it's upon you to decide the time that is appropriate for you. Because I believe in a day, in a daily schedule, you just have some time that, this time I should be at this point always, or at most of the time. You can also put them in your handbag so that wherever you are, the moment you remember, you just take your pill. Or you just put an alarm. You'll just be reminded that, it's time to take the pills. Because we are all doing a lot of things at the same time.
What happens in cases whereby a pill backfire?
Mostly when pills backfire, it's about the timelines of taking them, forgetting to take the pills. Because if you forget more than 2 to 5 pills in a cycle, then you're supposed to restart that cycle. Otherwise, you can easily conceive. Or use backup for the next 5 days. By backup, I mean you can either abstain or use condoms for those days to avoid getting pregnant.
Okay.
Yes.
Next one?
The other option is the injection, the 3 months injection, Depo-Provera. I know most of the people know it. You get an injection every 3 months. It contains progesterone only.
Okay.
So there are a bit of side effects that you experience with this, like you may not get your periods completely. They may come in form of spotting or become a bit irregular.
Okay.
However, the women will get their periods normally. In regards to weight, +2 -2 kgs, it's a progesterone only method.
Bonome smile.
I know it's a tricky part. Everyone is concerned about that. Now, from there, we go to the implants. Implants are plastic rods.
This is how an implant looks like?
Yes.
Yeah, for the sake of most men. Ni plastic too?
Yeah, it's a plastic rod. Let me show you.
Hi.
So implants are also progesterone only. We usually insert them into your less active arm. It's quite small. It's not uncomfortable. And we have both 3 years and 5 years. So if you're using this basically also because it's progesterone only, you'll have changes just around your periods. That maybe not getting them, spotting, or becoming irregular. And the other option is the IUD. And it's a point of interest, but we usually have the hormonal IUD. Forget about the strings. We usually regulate them. After the measurements and everything, we reduce their sizes. So this is an hormonal IUD. It's plastic. We insert it into the uterus. It releases hormones slowly. Lasts for up to 5 years.
Oh, that one can last for 5 years?
Yes.
The implant?
The implant, we have 3 years and 5 years.
Okay.
Yes.
5 years, 5 years.
Yes. And finally, the non-hormonal IUD. This one doesn't contain any hormones. This is just an image of the uterus. But I can just remove this for the sake of viewing. People call it the coil or copati.
This one, your coil? Yes.
It's non-hormonal. We insert it into the uterus. There's usually available in the market both 5 years and 10 years. This one is for 10 years. So when we use the long-term methods, I know I'm talking about years, and probably you want to plan yourself for 1 year, 2 years, or even 6 months. So in that scenario, you can use this method, but remove it when you're ready to conceive. Even for the implants or the hormonal IUD, the hormones will clear from your body in 7 days. So it's possible to take up these methods, yes, but you discontinue them once you're ready to conceive. Yes, or in case even you experience a side effect that you're not comfortable with, you can always discontinue the method.
Watu unaona? Kuna wale unaona?
Now, about kunona, the copper one, it's non-hormonal. It doesn't contain hormones. So there's nowhere you will talk about kunona ama kukonda.
Okay.
You just remain you.
So these other ones are the ones
these
that
other ones, not necessarily that they will make you gain weight. That's why it's a question that I usually answer with a yes and no. Because like the implants, the progesterone only, they usually have +2 -2 kgs. These methods affect the metabolism. So there are women who will use the contraceptive and tell you they have lost a bit of weight. And the others will use them and tell you they've gained a bit of weight. For both women and men, when our metabolism is affected, that's when we get to either gain weight or lose weight. So when you realize you have a lot of cravings or you just feel like eating back to back, you watch what you're eating.
Okay. This is interesting.
Yes. So as long as you're able to just pick how it's affecting you, you'll be able to regulate how you're feeding. If you realize you don't have any appetite, you can eat small regular meals instead of eating bulky meals, because if you have really a lot of reduced metabolism, you'll find that you don't feel like eating. You're just okay. And that's when you get to lose weight. And some really lose weight, and already the weight that you had, it's the kind of weight that you wanted. So you just have to find a balance between those two. For the pills, they cause a bit of weight gain, but as it's said, it's a side effect. Side effect is not a must for it to happen. These are also hormonal options. How my body may work around the hormones is different from how another person's body may work around that. And that's why coming to our facilities for counseling, assessment, and now when you experience the challenges, we support you through that.
Nice one.
Yes.
As we wrap up,
yes,
of course, on lessons of 30. So what could we just maybe mention to us now, chronologically, the wellness packages that one can find at any MARIESTOPES facility?
So we have packages that we have made for women at different stages. We also have some for men. But for women, we have the aspiring young woman. This is a woman between 16 to 24. Around 21 years. For these women, they have a package that is tailor-made for these women.
Okay.
And then we also have the one for the mothers. And for the mothers, for women between 22 to around 39 years. These are women who are going through the childbearing age. They are also going through phases of antenatal care, and there are assessments that they need to be able to do at least regularly, even if it's once a year. If you're pregnant or not, you need to have yourself checked. The tests that are appropriate for those women are the ones that we've put into that package. And then there's also the matriarch, the woman who is above 40 years. This is a woman who has then maybe probably the number of children that they wanted. They're also going through the menopausal stages, and they have their own package. And we also have a package for men. So if you want more details about this, I said you can always reach us out. We have different social media.
Yes, please.
You'll just be able to post them. And then also our toll-free number and also our WhatsApp number. I know the Gen Zs want to be able to chat through the process.
Exactly.
So we also have our WhatsApp number. You can be able to reach us through us.
Thank you once again for coming on the show. Lessons of 30 with Dr. Ofweneke. This was a special episode, just first of all to celebrate the role that MARIESTOPES has been playing for the past 40 years, and continue. You've continued being a pillar when it comes to matters reproduction. So happy birthday and happy anniversary to you guys once again.
Thank you.
So you said 16 facilities across?
Yeah, we have 16 facilities across the country.
8 in Nairobi.
8 within Nairobi and 8 outside Nairobi. And also our nursing home.
At Eastleigh.
Yes, at Eastleigh.
All right.
Yes.
So the contacts are right on the screen. The WhatsApp number, the toll-free number, and the branches to find them at. So you can always make a phone call anytime, any day, that you probably feel like there's some more further information that you need about how you remember, like we said in the beginning of the show, your health is your wealth. You must be able to know how your body is functioning at any single time as God continue blessing you with the gift of life. Thank you so much, ladies and gentlemen. Subscribe, Dr. Ofweneke TV. My name is the Eagle himself, the Duke of Kakamega. Dr. Ofweneke is my name. And of course, a big shout out, of course, to our guest lecturer on matters medical today, Madam Fera
Tinyari.
Yes, in Tinyari. She is a nurse by profession, but also branch manager Pangani, Marisop. So when you go there, this is the lady who will be in charge of you. All right. And you've heard, MARIESTOPES are professional. The nurses are kind. They are well trained and they're well invested in your well-being as a patient. Visit any of them, 16 outlets across the country, 8 in Nairobi. The other 8 are spread across Kenya, and of course with a special facility at Eastleigh. See you again next time.